Hi, it's Phil from Apnea Seal. Today's video is about how to get an optimal fit and a comfortable seal from the Apnea Seal N1 nasal mask. So the next step in achieving a good seal and a comfortable fit is to ensure that the 3D seal is placed up against the face first and foremost with light contact pressure. Now, if you observe any gaps around the edges or the patient can feel any pressure points around the face, then the mask fit is compromised, and it's best to call our 1300 number and speak to an expert for advice. In rare instances where a patient may have moved during the scan, then that could result in a 3D seal that has not been made optimally for the patient. The next step is fitting the mask to the wearer's head. Once you've fitted the mask to the wearer's head and you attach a CPAP flow generator, if you're achieving a good seal initially or a good fit, and subsequent to the fit, like during the night, the patient complains that there is a poor fit, it's nearly always due to some form of instability, whether that's the mask getting pushed into a pillow or whether it's the tube getting pulled or tubing drag. Anything that occurs during the night tends to be instability. If the mask doesn't tend to seal or fit under pressure while the patient is sitting up, it's possible that there is something that's gone wrong, and it's best again to call our 1300 number for some expert fitting advice. Our mask system does traditionally have a lot less strap tension than other masks, which means many patients do tend to over tighten the headgear, and you'll observe that the air bellows is either crushed, and when it's crushed, it can actually make noise. So if you hear a patient have a noisy mask, have them check that their headgear straps are actually not too tight. The other thing about having straps too tight is you can hear complaints of contact pressure on the nasal bridge or on the top lip, or even having the air bellows pushing up against the top lip when the straps are too tight. Some other reasons of soreness, say at the nasal bridge or on the top lip, can relate to tubing drag. So if you tend to have tubing drag that pulls the mask upwards, it tends to bear pressure on the nasal bridge and cause leak at the bottom. For the same reason, excessive tubing drag downwards can cause it to leak at the top and apply excessive pressure on the top lip. So the way that we manage this, and these techniques will actually help any mask system, but in particular the Apnea Seal, because of our exceptionally light strap tension, to improve comfort, is tubing management. Like all mask systems, the Apnea Seal N1 mask benefits from having good tubing management. Some patients do prefer the tube to be down the side of the body. However, if the patient is an active sleeper who rolls from side to side, you can appreciate that that can cause the tube to be dragged away from the wearer's face, and that the mask becomes unstable and can leak or make the mask uncomfortable. The best location for the tubing for an active sleeper is in fact over the head, which provides unimpeded movement for the patient without getting hung up on the tube. This is one of the benefits of having an axial swivel that allows this to rotate without twisting the tube. We also want to see this tube have some slack over the back of the head so that it doesn't pull on the mask, and also the tube can be passed under the corner of the pillow just to carry the weight of the tube that assists in providing more stability. That wraps up our tips and tricks in terms of how to get the best fit from an Apnea Seal N1 nasal mask. If you have any questions, don't hesitate to contact our 1300 number for expert advice. Thank you.